Hello guys. So magdiscuss magdiscuss tanan about sa exogenous pathway of protein metabolism. Sa so start. So the exogenous pathway, the newly synthesized the cyclomicrons in the intestine. It is initially secreted into the lacteals and then passed into the lymphatic ducts and eventually enter to the circulation by the way of thoracic duct. Then next, after entering the circulation, the cyclomicrons interact with the protoglycans such as heparin sulfate. Yan guys. Then on the luminal surface of capillaries in various tissues such as skeletal muscle, heart, and adipose tissue, the protoglycans on capillaries are also promote the binding of lipoprotein lipase, which it hydrolyzes the triglycerides on the cyclomicrons to free the fatty acid and glycerol, and the glycerol generate by taken up by the cell, guys. So and it used as a source of energy excess fatty acid, particularly in fat cells, are reesterified into triglyceride for long-term energy though. So it stores the intracellular lipids wrap a key protein in triglyceride metabolism is ApoC11, which is found on VLDL and is critical in the activation of LPL, critical activation. Then the hormone sensitive lipase, the lipase that is found inside adipose cell, release free fatty acid from triglycerides in stored fat. When energy source form carbohydrates are sufficient for the body energy needs. So guys, the exogenous pathway kuno daw for lipid metabolism is a dietary cholesterol and a fatty acid are absorbed, and the triglycerides are formed in the intestinal cell from free fatty acid, and the glycerol and cholesterol are esterified. Then the triglycerides and cholesterol combine to form cyclomicrons. Cyclomicrons. Then the cyclomicrons enter to circulation and travel to peripheral sites. The cyclomicrons ko mo-enter siya sa circulation and mo-travel siya to the peripheral sites. So the peripheral tissues have a free fatty acid and release from the cyclomicrons to be used as energy and converted to triglyceride or stored in adipose. Then the remnants are used in the formation of HDL. Then during lipolysis of cyclomicrons, there is transfer of lipids. During the lipolysis of cyclomicrons. There is a transfer of lipids, mainly the triglycerides and the apolipoprotein, the ApoA1 and the C2 into HDL, and the cyclomicrons are converted within a few hours after a meal into cyclomicrons remnants particles. Then the cyclomicrons remnants are rapidly taken up by the liver through interaction of ApoE, which the LDL receptor and other receptors on of cholesterol. Then it delivered to the HDL receptors, and after many enzymes in the cholesterol, the biosynthetic pathway are the main target. The main target for the cholesterol lowering stain type of drug. Then then are the downregulated along with the LDL receptors when there is extracellular cholesterol by a complex mechanism involving both genes regulation and post-transcriptional genes regulation. Then we talk about the abnormalities in LDL receptors. So the abnormalities in LDL receptors is a function result in elevation of LDL in the circulation and lead the hypercholesterolemia. So I i-correct na kong pronunciation, hypercholesterolemia and premature atherosclerosis. Yun. Yan guys. Then the patient daw na who are heterozygous for a disease called familial hypercholesterolemia. So the patient who are heterozygous for a disease are called familial hypercholesterolemia. Yun. Then we have a individual can be classified into two distinct phenotypes based on the LDL, namely type A and B. Type A is an individual. Ang type A is an individual have large buoyant. I don't know how to pronounce, but then the buoyant LDL particles. Whereas in type B, LDL particles are smaller. So it means the type A is a large buoyant, then the type B is the LDL particle na small, na have a smaller, then it elevated to VLDL is associated with an exchange of VLDL. So it's a elevated VLDL is associated with an exchange of VLDL triglyceride for cholesterol. So the esters in HDL resulting on HDL with decrease also exchange for VLDL triglycerides. So the triglycerides in LDL are subsequently removed by the action of lipase, producing a smaller, more dense and cholesterol containing particles. Containing a particle, this a small dense LDR smaller particles. That LDR particles have been found to be an independent predictors metabolic syndrome. So the LDR particles have been found to be an independent predictor. It's a independent predictor of CHD and is also associated with increasing risk of metabolic syndrome, which is a group of interrelated metabolic risk factors that appear to promote the development of atherosclerotic cardiovascular disease. So atherosclerotic cardiovascular disease is a promote the development is a atherosclerotic cardiovascular disease. Yun. Then the small dense of LDL particles have a longer half-life. A small dense LDR particles have a longer half-life in circulation than normal LDL and more likely to be modified and taken up by scavenger receptor to macrophage, which will develop into foam cell. One of the critical step in the development of atheroma, or it is so very difficult to define the degree of increased risk and small dense of LDR particle because the particle quantitatively because of the common association between the small LDL with other risk factor of atherogenic dyslipidemia. So I have question, what does HDL do? What does HDL do for you guys? So for me, the HDL is a small particle composed of phospholipids and a polyprotein and produced in hepatic and intestinal cells. That's the HDL do. Then why is HDL good? Why is HDL good? Nganong good man ang HDL? So the HDL is true to be an atherogenic and high HDL levels of cardioprotective. Then ang HDL then is a risk for myocardial infarction increase by about 25% of every 5 milligram decrement in serum HDL cholesterol below median value for men and women. Then the HDL then is good because it is incidence of coronary heart disease event in the normal population and inversely related to the serum and the HDL cholesterol concentration. It's have a low level carry on increased coronary risk. So we talk about the conclusion. So the exogenous lipoprotein pathway metabolism is he is responsible for transferring dietary triglyceride or the cholesterol and fatty soluble or the vitamins to the peripheral tissues. That major lipoprotein involved in the pathway is the cyclomicrons. So the next thing that we're going to talk about will be the exogenous lipoprotein pathway.
Exogenous lipoprotein pathway, and this pathway utilizes chylomicrons as their central lipoprotein.
A cyclomicron as their central lipoprotein. So this is the pathway that ultimately responsible for transferring fat in our diet to triglyceride and to cholesterol. Then for the exogenous dietary lipid metabolism, the 95% of dietary lipids are the triglycerides, but then the remaining about 5% of dietary lipids are the cholesterol, fat-soluble vitamins, free fatty acids, and the phospholipids. That the 5% of dietary lipids on the exogenous pathway and metabolism of protein. Yan guys. Then the second that will be discussed is the endogenous pathway. The endogenous pathway is the most triglycerides in the liver then that the package into the VLDL are derived from the diet after recirculation from the adipose tissue. For the adipose tissue, then this are normally only a small fraction and synthesized de novo on the liver. de novo on the liver. From dietary carbohydrates, the VLDL particles, once secreted into the circulation, is or undergo lipolytic process. It is similar to the cyclomicrons, but the VLDL loses core lipids, causing dissociation and transfer of apolipoprotein and the phospholipid to other lipoprotein particles like HDL, primarily by the action of LPL, resulting in the conversion of VLDL to denser particles called IDLs. IDL persists for short period of time, and receive cholesterol ester from HDL to exchange for triglycerides via cholesterol ester transferred to protein. So, we back the endogenous pathway for lipid metabolism. Ang endogenous naman pathway for lipid metabolism have a VLDL is the VLDL form in the liver from triglycerides and cholesterol esters that we talked kanina. This can be hydrolyzed by the lipoprotein lipase to form each IDL or VLDL remnants. The VLDL remnants are cleared from the circulation or incorporated into LDL. Then the LDL particles contain a core of cholesterol esters and smaller amount of triglyceride. So the LDL is internalized by hepatic and non-hepatic tissues. So in the liver, the LDL is converted into bile acid. So in the liver, the LDL is convert siya into the bile acid and secreted into the intestine. So in non-hepatic tissue, the LDL is used in hormone production. Ang LDL kay ginayuse siya for hormone production, cell membrane synthesis, o stored. Then the LDL is also taken up by macrophage and other cell, which can lead to excess accumulation and the formation of foam cell, which are important in plaque formation. Yan. Sana all. So the LDL particles are the major lipoprotein responsible for the delivery of exogenous cholesterol to peripheral cell due to the different uptake of LDL by the LDL receptors can pass between between the capillary endothelial cells and bind to LDL receptors on cell membrane that recognize ApoB100. Once bound to LDL receptors, they are endocytosed by cell and transport to lysosome. So where they degraded, the triglyceride in LDL are converted by acid lipase into free fatty acid, and the glycerol and further metabolized by their cell for energy and esterified and stored in lipid drops. For later use, free cholesterol derived from degraded LDL can be used for membrane biosynthesis. That's so previously we talked about the exogenous, diba? So we talk about endogenous naman, about some metabolism of VLDL. So the endogenous lipoprotein pathway begins in the liver. Diba, talk na ako kanina na nagbigin siya sa liver with the formation of very low density lipoprotein. With the formation lagi sa very low density lipoprotein na mo na ang VLDL. Then they are made of primary triglyceride Japan and function to deliver the fatty acid to peripheral tissue such as the muscles and adipose tissue. So I talked with you the formation of releasing the VLDL or the very low density lipoprotein. So the hepatocyte load the hepatocyte load triglyceride into a structural apolipoprotein called ApoB100 to form an nascent VLDL particles. They are then released into the blood where they interact with the circulating HDL to obtain ApoC2 and ApoE. This converts functionally into the VLDL or very low density lipoprotein. That's the formation and releasing of VLDL to the metabolism. Then we talk the clinical pearl it is a condition such as obesity, diabetes mellitus or type 2 and alcohol ingestion. There is a imbalance between triglyceride synthesis and VLDL synthesis and release in this condition triglyceride synthesis overall problem to release the VLDL thus increasing fat and accumulation in the liver. This is called hepatic steatosis or fatty on liver. That called hepatic steatosis and are called the fatty on the liver. Yan po. Then the LDL can do one of two things. First, they can interact with circulating HDL and transfer the ApoE, thereby giving rise to low density lipoprotein. Then, secondly, they can use their ApoE as a ligand and be taken up by cell via receptor mediated endocytosis. Yan, that's the second one. They can use their ApoE. Then the very low density lipoprotein modification are particles circulate through muscles and adipose tissue. The capillary to deliver fatty acids. This is the archive through the activity of lipoprotein lipase, which degrade the triglyceride into fatty acids, and the glycerol of the fatty acids are absorbed by peripheral tissue and either used or have no sustain of energy of production or are stored fats or we unsa na what call that we overuse the energy and the triglyceride are broken down. It becomes smaller and deeper as the transfer in the HDL. They become intermediate density. Yun. So, explain na yung, yes. Yun then, isa pa. So, in the metabolism of LDL particles, so low density lipoprotein. The low density lipoprotein, so inside our liver cells, we produce VLDL. And so they contain a very high amount of triglyceride. They contain what do you call that? They contain very amount of triglyceride and they can also contain like some like cholesterol and like cholesterol or cholesterol esters ganon, proteins and phospholipids mo ng mga. So the point of building this VLDL is about we build the LDL particles is to move triglycerides and other fats to other extra product. So the muscle tissue, adipose tissue are there. We have lipoprotein lipase, and these lipase break down the triglyceride. So then the VLDL into the fatty acid are they're absorbed. They absorb the fatty acid, then the product tissue, and then this process happen over and over and over again. Then eventually, when enough triglycerides are broken down, they remove from the particles. We form an IDL particles, and so the IDL causing density to the lipoprotein contain fewer triglyceride. Then the triglyceride molecules, then the VLDL, now the IDL has one of two fates of IDL, either is taken up by the liver by other exahepatic cell via this process is receptor mediated endocytosis, or can be further broken down into the DL low density lipoprotein. And so as we remove more and more triglyceride, then it contains the lowest amount of triglycerides and in the highest cholesterol. The uncholesterol esters, for reason LDL considered a bad cholesterol, it's a bad lipoprotein. Bad cholesterol and bad lipoprotein, it happened with LDL with about 70% of the LDL of the normal condition are absorbed and cleared by the liver, and the remainder is taken by the extra product tissue. So it's the lecture like to the focus of the individual particles we absorb by the liver. So in another pathway in which HDL mediated the removal of cholesterol from cell involved the ABCA1 transporter. The ABCA1 transporter is member of the ATP binding cassette transporter family, which pump various ligands across the plasma membrane. Defect in the gene for the ABCA1 transporter lead to Tangier disease, a disorder associated with low HDL and predisposition of premature CHD. The exact of substrate for the ABCA1 transporter is not known, but it believed that the transporter modifies the plasma membrane by transferring a lipid, which then enable ApoA1 that has dissociated from HDL to bind to the cell membrane. So the newly form of HDL is then competent to accept the additional cholesterol by the aqueous diffusion pathway, and it's eventually converted into spherical HDL by the action of LCT. Recently, ABCG1 and ABCG5, which are other ABC transporters, have been described has been described and facilitate the efflux and cholesterol to lipid-rich spherical HDL via mechanism that appears to be different than ABC1 transporters. So, although the term of lipids have several types of molecules that lipid metabolism usually refers to the breakdown of synthesis or fats. So, the third discussion that I discuss is about the atherosclerosis formation. So, what is atherosclerosis? The atherosclerosis are called hardening of the arteries. Sometimes called as atherosclerosis, sometimes called hardening of the arteries. It's a cure when it's a cure of fat, cholesterol, and calcium build up inside the lining of the artery wall. Amo na si atherosclerosis ang naga-build up inside the lining of the artery wall. Then it's forming a substance called plaque yan, o what di ko kabalon sa pag-pronounce, but I read it plaque. Over time, the fat and the calcium build up narrows on the arteries and block blood flows through it. So the atherosclerosis can happen in all arteries. Sa arteries ni siya nagakita. Then, if you have atherosclerosis in one of your arteries, there is a good chance that you have atherosclerosis in other blood vessels throughout to your body. Yun. So, guys, we talk the problem of atherosclerosis, or unsay yung mga cause, unsay yung mga source of problem. So, first is the coronary artery disease. Ang coronary artery disease is effect of atherosclerosis that supply blood to the heart. It supplies blood to the heart, the coronary arteries. It can restrict blood flow to the heart muscles. Mo siyang coronary heart disease, affect siya sa na siya problem sa arteries that can supply blood to the heart. Then second is heart attack. So common, di ba, ang heart attack sa plaque caused by atherosclerosis. Japon ang heart attack because it's surrounded siya sa heart of fibrous cup, sa heart, diba? Then this fibrous cup by tear of rupture, gina-rupture niya munang. Then a tear of rupture tell the body to repair the injured artery lining, much as the might of heal, then i-cut on the skin by forming a blood clot. Nag-form siya blood clot to seal the area. The blood clot that form in an artery can completely block the blood flows. Then the flow of the blood flow to the heart, the muscles cause a heart attack. Mo nang ang muscle ga pump man na siya, so can cause siya og heart attack. Then for example, stroke or transient ischemic attack, asthma, mo nang mga effect sa mga atherosclerosis affect that arteries that supply blood to the brain. Nang stroke naman, kanang much supply blood to sa brain, kanang grabe ang pag-supply og blood sa brain mo, nang maka-stroke ta kay magputo ang ugat sa ulo, yun mapatay. Then it cause transient ischemic attack. manang delikado gid ang mga cause niya mo nang sa mga taong high blood ra, di ba? Ana dyan na ako. Then third, the peripheral arterial disease. Ang peripheral arterial disease is a effect of the arteries naman na in other part of the body such as the pelvis and the ledge. The pelvis and ang sanang isa, pelvis and legs, causing poor circulation. Masya mga cause na siya sa atherosclerosis. Then ang fourth is the abdominal aortic aneurysm. Yung nabalita nun na magputok lang, yun katong sa balita atong flight attendant, di ba? Atherosclerosis can make the walls of the aorta weak. The aorta is ang aorta is the large artery that carries blood from the heart to the rest of the body. So if kana may maka-problem pag magputok na, patay naman. Mana. So guys, we talk about naman sa how nato siya i-prevent ang paano nato siya tambalan ang atherosclerosis na kuan. So it's involved lifestyle, di ba? Dapat always ka healthy, ga exercise ka, na you need to quit smoking, then take vitamins, then take medicine to help to reduce cholesterol or fats, di ba? Na maka high blood, na ilas nimo ang mga pagkaon na dili good for you. Kung may idea naman ka na padulong ka na good, then control your high blood pressure, gina-control nimo, gina-maintain nimo imong blood pressure, then i-manage nimo other thing that can increase or increase sa imo risk of heart attack or stroke or other complication. Then the atherosclerotic plaque formation have a 5-step. So first is the low density lipoprotein. The lipoprotein is a LDL accumulation in the intima. So second is the oxidation of LDL. Then third is the recruitment of monocyte and macrophage. Then fourth is uptake of oxidized LDL by macrophage scavengers, receptors, and transformation of macrophages into foam cell. Then fifth is the formation of a fibrous cup containing smooth muscle cells, which permits stabilization of the plaque. And each step of this process, inflammatory cytokines are implicated, making the atherosclerotic process of chronic inflammatory diseases. Yun guys. So, the blood vessels and endothelium is made up of single layer of cell and does two jobs. Then first is protect the rest of the blood vessels wall from the blood, like coat of varnish on your wood furniture. And then secondly is secrete protein on its surface to prevent the blood from clotting, because blood just inherent likes to clot whenever it gates. Diba ang blood pag makuan magclot man gid pag manginan na or ma-dry. Yun. So your endothelium can become damaged in lots of different ways. Like for example, low density lipoproteins or chemicals from smoking, cigarettes, and high blood pressure all wreak and havoc on the endothelium, because this inheritance break down the endothelium. So the damage of endothelium allows low density lipoprotein to enter the endothelium walls. So then the white blood cells called monocytes. The white blood cells called monocytes, the low density lipoproteins and break them down through oxidations. Break down through oxidation. So it means, so you think the macrophage eating the embedded low density lipoprotein is a good thing, because but if there is a lot of low density lipoprotein, then macrophage will eat so much cholesterol that it can die. Will die. It basically eat itself to death. Then after it dies, it deposits itself under the damage of endothelium. After na mapatay siya, gina-deposit niya iyang self under the damage of endothelium. So now we have a dead macrophage filled with low density lipoprotein stuck in the damaged, right? Then endothelium as well. Then this dead macrophage are called foam cells. Mao nang gina-called na foam cells ang mga dead macrophage. Then and that because some guy a while back look at these things in the microscope, and through they look like foam on the beach. Yes, like foam in the beach. Then hence the name. Then also when the macrophage dies, it releases cytokines which calls over more monocytes, which come over and eat low density lipoprotein and inevitably dying while dying. So, and this is vicious cycle of gross overheating and massive fatalities has begun. So the accumulation of plaque in the vessel mess up the ability high density lipoprotein to remove the calcium from the vessel. So build up the calcium occur in the vessel wall and it crystallize. Now remember, the calcium makes stuff hard, which is your bone are full of calcium, right? So this deposit of calcium into the plaque is what stiffen walls of the arteries. Now remember, the word that describe the immune system getting involved are called inflammation. So an atherosclerosis is an inflammatory disease. Mo nang ginakalled na ang atherosclerosis is an inflammatory disease. So daw another side, the protein called C-reactive protein increase in the blood during an infection. Then, while elevated C-reactive protein is not specific enough to diagnose atherosclerosis, because it can act as like a red flag that atherosclerosis might be occurring, especially in someone has atherosclerosis symptoms or other risk factor are from time to time that fibrous can crack and expose the underlying thrombogenic foam. And this can happen randomly, and when it drills within moment, you can see a blood clot. That start from within, already partially include the artery, quickly leading to even less blood. Being able to flow by after about 70% of blood vessels is occluded with plaque. The overleating of blood, clot cell injury and death begin in areas that were relying on the blood flow. If blood flow reduced in the coronary arteries, angina and myocardial infarction can occur. For the serious included, the internal and carotid middle cerebral arteries lead to stroke. Then the atrophy occurs superior mesenteric artery affect the small intestine, and the rest of that is the injury of downstream. Then the polypetal artery can cause peripheral vascular ischemia like gangrene of claudication, which is frequent leg cramping during exercise. Now, the building of the plaque also weakened the artery walls, which means it can lead it can aneurysm. It can lead aneurysm. Explain why atherosclerosis is main cause of abdominal aortic aneurysm. It because if we move on the kidney plaque build up the renal arteries, reduce the blood flows, the blood flow unsa pa man na, into the blood flow. Then for my conclusion about the atherosclerosis occur when the blood vessels that can carry oxygen and nutrients from your heart, the rest of your body arteries become thick and stiff. So sometimes restricting blood flows to your organ and tissue. Healthy arteries are flexible and elastic, but over time the walls in your arteries can harden and condition commonly called hardening of the arteries. Then the atherosclerosis is a specific type of arteriosclerosis. The atherosclerosis is a specific type of arteriosclerosis. Yun. Then the atherosclerosis is the build up of fats. It's a build up of fat of cholesterol and their other substances in and or on artery walls and on artery walls. This build up called plaque, di ba? We called plaque. Then the plaque can cause your arteries to narrow, blocking blood flows. Ang plaque ang ga-block sa mga arteries to narrow, blocking blood flows. The plaque can also burst, leading to the blood clot. Then the atherosclerosis is often considered a heart big problem or very very big heart problem. It can affect arteries anywhere in your body. Atherosclerosis can be treated healthy lifestyle habits and it can help to prevent atherosclerosis. Then ang cause sa atherosclerosis is high blood pressure, high cholesterol, high triglyceride, smoking, insulin resistance, obesity, diabetes, mo ng mga diabetes people, dali lang kayo ng mga kuan. Then inflammation from unknown cause from disease, there's arthritis, lupus, psoriasis, inflammatory bowel disease. Then mga person na mga hilig og mga fatty food, yan, mga soft drinks ganun. Then you prevent have atherosclerosis if you quit smoking, if you eating healthy food, then exercise regularly, maintaining healthy weight, then checking and maintaining a health blood pressure and checking maintaining health cholesterol and blood sugar levels. Just remember to make change one step at the time. So if you have any question, nan mo lang na, then so it means the atherosclerosis is the leading cause of death na disease that develop sa anywhere or bisag asa na countries like mas common sa Philippines ata pero dili ko sure. Then it's a deep understanding din naman na of the cause of underlying mechanism of pathogenesis na will help the delineate cause and will help to plan out innovate management as our knowledge about the pathogenesis atherosclerosis improve, more treatment option will emerge. Yan lang. Then it's a basic pathogenic. It's a basic pathogenic mechanism that inflammation of oxidative stress involving the interaction with multiple genetic disease, then epigenetic environmental factor, then the LDL-C and its oxidative modified form of contribute for multiple stage of atherosclerotic plaque development through production of inflammatory cytokines. It's understandable din naman of pathogenic role of genetic, diba? Then epigenetic, inflammatory, and immune mechanism of atherosclerosis of molecular level may be attractive target for disease prevention and or treatment.